Hey guys, we're back with a video today on neuromas, neuritis, bursitis, which is a little rhyme for you.
So, we often see these coming into clinic, and they are essentially, neuroma and neuritis are entrapments or irritation of the nerves that run in between your metatarsals.
These long bones here.
This is my lovely assistant Sam.
You have some little nerves that run between all of them, nerves that run around the side. Basically, any one of these is capable of getting irritated. So an irritation of a nerve is a neuritis. If a nerve gets thickened, almost like a growth forms on it, it's what we sort of call a neuroma. The most common thing is a Morton's neuroma. People have probably heard of this before. A lot of patients come into clinic saying, I've got a Morton's neuroma.
Absolutely, and that technically is a neuroma between numbers 3 and 4, so it's this interspace here, but a neuroma can develop technically in any of the interspaces in between the metatarsals.
Exactly. A bursitis is slightly different. A bursa is just a fluid-filled sac which we have all over our body, little fluid-filled sort of capsules which help where we've got bones close to other bones as a bit of a sort of lubricating sac effectively. But when that becomes inflamed, it can press on the nerve, which has or sort of mimics the symptoms of a neuroma or neuritis. But what are the symptoms? What do people come in with?
So most often people will say it feels like I've got a sort of stone in my shoe, or I want to take my shoe off and rub it and release something. They've got this sort of pain, and it's often described like a numbness or a shooting kind of pain. It's very irritating, and they're not quite sure sort of what it is or how it feels, and that's really common with nerve pain.
Yeah, people don't know exactly where the problem is.
Yeah.
Some people feel it more in their toes, other people in the ball of the foot.
Yeah.
I think burning as well is one of them. Burning and tingling are very common symptoms, and I remember a patient saying to me once, it felt like someone was lighting a match or a lighter under their foot, and it was just this excruciating, takes your breath away sort of sharp pain.
Yeah.
And that's what tends to bring people into clinic.
I think the interesting thing about nerve pain actually is every patient experiences it quite differently. That's really common as well.
Yeah.
So it's really important that when you're having this conversation with your podiatrist about these things, you're as descriptive as you can, and take a diary of what hurts it the most and what sort of activities really bring it on, and what
footwear.
shoes you were wearing, that kind of thing. That could be really, really helpful for us to help you to ascertain what it is that's going on there.
I think that brings us nicely on to how you can help yourself.
Yeah.
The biggest possible thing you can do to help yourself is change your footwear. If you're getting these symptoms of burning, tingling, shooting pains in the toes, this sort of numbness, appraise your footwear. Have a look. Are you wearing things that are too tight, heels, very thin-soled shoes that are coming into a point or too narrow, squeezing your toes together and literally squeezing the nerves? If you can immediately start wearing things that are wider fitting, allow a little bit more spread, not like that.
No, I was about to say, so if you can imagine your foot is in a heel,
Yeah.
you're going to put weight on that portion.
And the stiletto front.
Yeah, that's going to
It's just gonna
squash
squeeze
the
your toes.
toes. Okay, so try and avoid pointed high shoes if you've got this kind of problem.
But yeah, wider fitting, rounded trainers, rounded shoes, and just see if the symptoms settle down.
Yeah.
But if they don't, the best thing to do is get an assessment. There are loads of things podiatrists can do. So we'd sort of begin with a clinical assessment, having a feel, maybe a little squeeze of the forefoot and feel if there's almost a click, which is called a Mulder's click, which is a bit of a diagnostic indicator. But lots of different tests we can do and rule out other things in that area. Have a look at podipedia.co.uk, because on the bones, joints and soft tissues area, there's lists of things that can cause pain in that area. Neuroma, neuritis, bursitis, just one of the many things, but certainly lots of things we can do. And then if we're unsure, imaging.
I was just about to say exactly that. So
I read your mind.
realistically, we can do some diagnostic tests in clinic and think, yes, this possibly sounds like a bursitis, but really an image is the best thing to help us actually diagnose this.
Ultrasound, they show up on ultrasound really well.
Yeah.
If you've got them on screen, if there's a sonographer or a podiatrist who can inject, sometimes an ultrasound guided injection can be used.
Yeah,
but
that's a steroid injection.
Steroid injection. There's more info on the website about this as well. Also, shockwave therapy has been quite effective. Manipulation, sort of mobilization.
Absolutely.
Foot orthoses. So I've got a metatarsal dome here, which would sort of go onto a device, and basically sort of spread the transverse arch, increase the space between the bones to take the pressure off the nerves. That can work. It doesn't work in everybody.
No.
Some people find them more uncomfortable. So
exactly, the more you put in your shoe, the less space you've got. So it's very individual, but as you can see, there's lots we can do and lots we can help with, and we can certainly guide you through the process of helping to get this better for you. So if you want to find a podiatrist locally to you, you can go on the directory at podipedia.co.uk and find someone locally to you who's HCPC registered and get in touch with them.
also have a look on there, because there's information about possible surgical procedures for this, which is a further sort of stage of treatment. So there'll be more info on the website about that as well. Also, subscribe to this channel, guys. Get tons more content and more information as we post videos.
Absolutely. And we'll see you next time.